All right, so we're going to get started with today's webinar. I just wanted to remind you, if you have any questions at all, to please use the Q&A tab and not the chat function. It's easier for us to see the questions and answer them in order in the Q&A tab. If for some reason we run out of time or I'm unable to answer the question for whatever reason, want to run it by a colleague, we will get back to you via email with your answer. So today we're going to talk about an increase in shedding during the COVID-19 pandemic, or otherwise known as telogen effluvium. So I have been here the past Wednesdays. I think this is the 4th or 5th webinar, just to kind of talk about different topics over the past weeks. We'll be doing another one next week as well. So if you missed any in the past, they're all up on our website that you can check out. These are all recorded and will be available to you later if you want to listen to anything again. So our agenda for today, we're going to talk about what is normal versus excessive hair loss. We'll talk about telogen effluvium. We'll talk about why people are shedding now, and then prevention and treatments, and have time for questions at the end. So this is just a little bio about myself. If you've tuned in to the prior webinars, I apologize, it's a little repetitive, but I've been a nurse for about 10 years. I've been a nurse practitioner for about 5 years now, and I have about 5 years of aesthetics and hair restoration, and I joined the practice in October, just this past 2020, a couple months ago. This is a little update about our office currently. So we are fully open. We've started to move follow-up appointments to telehealth to kind of just further limit in-office traffic. We're trying to limit the number of patients that we'll be seeing every day just to limit exposure. We have, pretty enhanced safety protocols. So temperature screening, masks are required at all times. We have increased time between appointments to sanitize all the rooms. We have air purifiers in each room. And if you're still, unable to come in or afraid for exposures, we're still available by phone and video appointments. And, we really recommend taking advantage of these if you're not comfortable to come in for treatments, just so that you're not falling out of any treatments that could be helping you in the, upcoming months until things hopefully go back to normal. So we are still able to ship products to you to ensure that you continue to have your treatment during this time. And we also have our online store available that you can order through and order any products that you may need. So first, we're going to talk about what is normal hair loss. We're going to address the hair life cycle, again, normal hair loss, and then excessive shedding. So a lot of you have seen this slide before. I apologize, it's a bit repetitive, but it's always good to kind of review the 3 phases of the normal hair life cycle. So the anagen, catagen, and telogen phase. In the anagen phase, or the growth phase, this is when the hair is receiving all the nutrients it needs, it's actively growing. One of our big treatment goals here is to prolong this phase. And under normal circumstances, we have about 90 to 95% of our hairs in this anagen phase. This is the start of the hair life cycle. It's where blood supply nourishes the follicle with important nutrients, and it lasts anywhere from 2 to 6 years. The next phase is the catagen phase, or the transition phase. There's no further growth happening here. The hair follicle starts to detach from the blood supply. The hair won't grow longer or thicker at that point. It can last anywhere from 2 to 3 weeks. And then lastly, the telogen phase. This is known as the resting phase. The hair will fall out. There's no nourishment, so it falls out, and this can last anywhere from 3 to 4 months. Then a new hair will grow. And everyone's hair is cycling through these phases. When the hair falls out, typically a new hair is behind that and growing back in its place. Over time, because of, so although we shed a certain extent every day under normal circumstances, there's always a balance. So you're always maintaining that same head of hair, essentially. when this cycle kind of gets disrupted is when you start to come into some problems. So over time, because of genetics, it's possible for the entire hair life cycle to shorten. Overall, like I had mentioned, your hairs are in the anagen growth phase for less time when you're kind of going through a genetic change or telogen effluvium that causes these hairs to miniaturize, or what we also call female pattern hair loss. So normal hair loss, every day we lose some of our hair to a certain extent. It's absolutely totally normal, and everyone experiences some degree of shedding every day. Everyone loses between 100 and 100 strands daily, depending on how much hair you have, your age, hormones, and your hair's natural growth cycle. Shampooing less than daily can actually skew the perception of this, because most of the hairs are already falling out in that resting phase or telogen phase. They've already detached from the blood supply. They're resting there, essentially waiting to fall out. And in that previous slide where I talked about the 3 phases, normally about 90% of our hair follicles are in the growth phase or anagen phase, 5% are in that transition or catagen phase, and then anywhere from 5 to 10% are in that telogen phase. So when we shampoo, we're actually kind of scrubbing the scalp and manually dislodging those and pulling those hairs out. Those hairs were going to fall out anyway. So sometimes people ask, should I not shampoo? Am I causing more trauma? No, they were going to fall out anyway, whether you're shampooing or not. So they're resting there and you're manually stimulating them during the shampoo. So for people that wash their hair every day, they're typically going to see 50 to 100 hairs falling out. For women washing their hair every 2 days, you're going to see about 100 to 200 hairs falling out, and so on and so forth. And this sometimes causes women to shampoo less, skip a day, another day, and by the time you get down to 1 shampoo a week, in some cases you're seeing a lot of hair coming out. It doesn't necessarily mean that you're losing more hair than you would have if you just had shampooed daily. So hair shedding is a natural bodily process that's experienced by everyone. It's necessary to create new space for those hair follicles to grow. So like I said, you always have a hair coming in that's going to grow behind the hair falling out. And normally there's a balance between the amount of hair that grows and the amount that falls out. And when there's not, that's when we potentially think of, okay, there might be an issue here. So excessive shedding, or the medical term for excessive shedding, is called telogen effluvium, TE for short. So hair loss is considered abnormal when a significantly greater amount of hair falls out than is coming in. Losing more than 100 hairs per day is not a common occurrence, and if you're noticing more visible of scalp, mounds of hair in your shower drain or on your pillow or in your hands, it could be a sign of excessive hair loss, and it could be an issue. In 2016, there was a study done on prevalence of shedding in females, and in non-female pattern hair loss subjects, approximately 40% experienced excessive shedding on hair washing days versus 8% on non-hair washing days. So basically, women saw more hair loss on hair washing days, so the percentage of women that reported excessive shedding were actually noticing that on hair days or washing days versus not. In female pattern hair loss subjects, approximately 60% experienced excessive shedding on hair washing days versus 19 non-washing days. And then really what they found was that the shedding was more common interestingly, in younger women versus older women. And we've observed a strong correlation between reported shedding and hair length, with the most shedding being reported on subjects with longer hair, longer than shoulder length. Excessive shedding was not correlated to the use of hair dyes, weakly correlated to the use of frequency of hair washing. So although a lot of hairdressers may tell you, try to go as long as possible without washing, it's not always necessarily great, because we like to provide a healthy, clean environment for those follicles so that your hair can actually grow. If they're clogged with oil, dry shampoos, other things, you're not going to have that hair grow in nicely like you may want to. So we typically recommend washing your hair every other day or every 2 days. Talk a little bit more about telogen effluvium. We'll talk about an overview, common causes, and then diagnosis. So telogen effluvium, or TE, is a common and temporary cause of hair loss. It can be acute or chronic. Acute TE usually has a causative factor. Chronic TE is rare, but it can become chronic if the TE doesn't resolve within about a year. So sometimes we do see women with a chronic TE. You know, they may have come in when their TE was acutely active. We checked labs, maybe started some treatments, but we never really saw a resolution of that TE. That's when we say, okay, maybe this is chronic, and you know, we can't find a cause for it. It's something that just continues to happen. But acute TE is something that we're doing some research. We want to know if there's any stress going on, what your diet's like, if you've had any surgeries, what medications are you on, how often are you shampooing your hair, different things that will help us to determine what is the causative factor here. Typically, TE presents as a diffuse hair loss, meaning it comes from all parts of the scalp. You know, versus androgenic alopecia, where typically we see that in the front, temples, and crown. Most commonly, a woman will see just an increased shedding of hair, so increase when you run your fingers through your hair, increase in the shower. This is usually reversible, and complete regrowth can occur in about a year. That's a year from the time of the loss stopping. So as soon as that shedding period is over, meaning you'll see regrowth after about a year, that complete regrowth after a year that shedding had stopped. So when we treat this, we have to treat both the hair loss and the underlying cause. So again, we're trying to find that underlying cause and fix the underlying problem so that the shedding will stop and not continue. Often we're doing these at the same time. We're treating the underlying cause, and we're doing some type of treatment to help minimize the amount of shedding that we're seeing in the interim until we can stop it completely. The typical time frame is anywhere from 2 to 4 months following a particular insult or stressful period, and this can last up to 12 months. Sometimes people notice the shedding happening sooner. Basically, we want to maximize this time frame and the amount of hair that will come back. So common causes of TE. This is where it gets tricky for us as providers, because you know, someone comes into the office with TE, it's important to figure out what is the case, you know, and oftentimes it's not just one thing, it's a combination of things. So we frequently see it in nutritional deficiencies. So protein, vitamin D, iron, folate, B12 are the most common. We can actually do lab work to screen, you know, for a lot of these. In terms of protein, you know, diet itself, we want to aim and shoot for at least 60 to 65 grams of protein in your diet every day. And we'll talk about a little bit more about that later. Weight loss, sudden or rapid weight loss, keto diet. I'll talk more about the keto diet in a little bit. Surgery, especially bariatric and weight surgery. So bariatric surgery can affect the way your body absorbs nutrients, and people tend to rapidly lose weight quickly after those types of surgeries. Another cause, medical illness, especially when fever is involved. So if you're sick, if you're hospitalized, if you've had COVID-19, psychological stress from the pandemic, or just can be anything really, but commonly, you know, we'll see psychological stress that is the result of hair loss, including like deaths of loved ones, moving, job changes, really anything that causes stress. In one study that we found, it was shown that physical, emotional stress, and nutritional deficiencies accounted for 60% of all TE cases. So imbalance in hormones, season changes, particularly the winter to spring and summer to fall season changes, excessive sun exposure, endocrine disorders, thyroid imbalances, scalp conditions such as psoriasis, eczema, lupus, seborrheic dermatitis. Some of these other things that happen, you know, they'll go away. It can be a waiting period. You kind of have to wait for your body to work it out and restabilize. But we'll talk about all of these and kind of how we treat them. So the first thing, the most important thing, is to have an appropriate medical evaluation and diagnosis to determine if this is TE or is it something else. So we do a really thorough hair loss history, medical history, including medications, you know, Have you started anything in the last year, discontinued anything, have the dosages changed, anything that may be contributing to your hair loss. We do a physical examination of the scalp. We use a trichoscopy machine. So this is a magnifying device to see if the hairs are miniaturizing or thinning in diameter, how many follicles are there that don't have hair in them, etc. We do a pull test. So this is where we take a small bunch of your hair that we pull, and that allows us to see how much hair is coming out. Based on the results of that, we can determine if TE is present or not. We often, not always, but we'll often check labs. So if you haven't had labs done within the past year, we'll want to know things like a CBC, total blood count, your ferritin, which is a measure of your iron stores, TSH, which is a measure of your thyroid function, testosterone levels, vitamin D. Sometimes I mentioned the folate, B12, sometimes other things as well. It really depends on what's going on from person to person. Rarely, we'll do a scalp biopsy in like less than 5% of our patients. This is something we can do in the office if we decide it's appropriate. We basically take a little punch of skin from the scalp. It's the size of a pencil eraser. And then we place 1 to 2 stitches, and that will actually, we send that off to the pathology lab. It's reviewed by a pathologist who kind of specializes in alopecias, and we'll get the report. It takes about a week. You come back for the report and we'll remove the stitches and make a plan from there. It's really to kind of determine if it's something other than androgenic alopecia, if we're looking more at like a scarring alopecia. So has there been an increase in shedding? So we'll talk about what we're hearing from staff and from patients, what we're hearing from colleagues and in the news, and potential causes of current shedding, particularly with the pandemic. So what we're hearing from staff and patients, as early as March last year, we heard a number of patients were complaining of increased shedding. While this would be pretty early to be caused by the pandemic in situations of extreme stress, it's not unheard of. And we've been hearing here in the office that, from longtime patients who experienced significant shedding compared to years past, this year, just with all kinds of stress related to COVID, whether it be, just worrying about the virus, having the virus, work changes, all those things. We've seen a big increase in shedding this year. So starting in July and August, we started seeing many stories in the news about an increase in shedding. This was not necessarily regarding patients only with COVID-19. Infections, meaning you were post-COVID-19 infection and saw an increased shedding. It kind of lines up with the timeline of intelligent effluvium, meaning, it's 45 months after the start of the pandemic. So after the start of that initial stress that we all experienced, at the end of July and August into the fall, we started seeing an increased number of people complaining about increased shedding. Hair loss specialists and dermatologists throughout the country have been seeing an uptick in patients experiencing severe shedding starting this past summer. And actually in New York City, there were kind of a poll of dermatologists. They said they saw a greater than 25% increase in patients complaining about increased shedding early in the pandemic. So potential causes of shedding this past year. So seasonal shedding is a big one. So there was a study done in 2009 showing that seasonality of hair shedding in healthy women complaining of hair loss. There were 2 times when telogen rates were at their highest. So the first was in the summer and the second was in the spring. So since this telogen phase lasts around 3 months, we would expect increased shedding to occur 3 months after the peak time. So we see a lot of shedding in midsummer and fall. Another big one this past year is stress, like I mentioned, due to the current pandemic situation. So also this year, stress from the world in general. So it's just been a tough year for everyone. We've experienced a lot of changes and stressors in just a short period of time because of the virus and other things. It's really disrupted all of our lives. It's had major changes to our sleep and nutritional patterns, protein and vitamin deficiencies. A lot of people are kind of have been home and really working on themselves. Some people have really tried kind of dieting this year. One thing we've been seeing is a big increase in people trying the keto diet. And we see a lot of increased hair shedding with people on this keto diet because, the way your body metabolizes carbs while you're in ketosis for energy versus fat for energy, it can cause significant stress on your body. Keto aside, losing a lot of weight can increase shedding from that. And another, big one in terms of nutrient deficiency. So 90% of your hair is actually made from protein. So when you're not getting enough protein, your other organs like your heart, your lungs are actually going to steal that protein away from the hair. And the hair is the last place that gets that protein and will be the first to suffer. So COVID-19 is a cause of hair loss. Studies have shown that roughly 25% of those diagnosed with COVID have had some hair loss associated with it. So, anyone diagnosed with COVID is experiencing varying degrees of stress to the body, but we have seen about 25%, a quarter of those people having reports of hair loss. There was a study that showed COVID-19 patients, increased shedding was seen on average by day 58, and most commonly was seen worse with severe cases of COVID-19. So one thing we did see, long haulers, what we call them, are people with persisting symptoms for many months after a COVID infection. They reported that, 30% had prolonged hair loss. So COVID can definitely cause TE from stress, but this infection has pro-inflammatory and vascular effects, so it can also damage to this, cause damage to the skin, to the follicle, and it's unclear how long this could last. We have also heard that COVID can precipitate alopecia areata. So, a lot of people are asking, will I experience shedding from current stressfuls? This is a stressful time, but it doesn't necessarily mean that everyone's going to experience shedding from it. It's important to just know that this type of stress can really affect our body and our hair, and it's important to focus on ways to de-stress to avoid shedding, 2 to 4 months down the line. We do see that people who are prone to shedding, who have had increased shedding in the past, are at higher risk for shedding in the future. And then other people have had to make lifestyle changes, like I had mentioned, dietary changes or less exercise. Your gym isn't open, could be more prone to a TE or increased shedding. Next, we're going to talk about a little bit about treatment and prevention of TE. So it's super important to treat both the causative factor and the hair loss. You need to treat them together. Treating the causative factor alone can be effective, but there are some treatments that can help minimize the shedding and get the hair to grow back faster. Treatment that we typically recommend for TE is the low-level laser therapy. This can be done at home, which is great. We use LaserCap, which is the top of the line laser. It's only sold through physician's office. You can't get it online. You have to kind of order it through a licensed vendor. So if you're interested, you can go to lasercap.com, but like I said, you have to go through a medical provider to purchase it. The way it works, it's just a cap that you wear on your head 30 minutes a day, 3 times a week. Super easy treatment to do at home. No masks, there's no solutions, anything like that. One thing we have added this year is the Tresse 3X growth serum factor, the growth factor serum, and a microneedling kit. So this actually contains amino acids and growth factors that get microneedled into the scalp. This can be helpful to stopping the loss and helping that hair come in faster. So this is done once a week for the first 3 months, and then you continue once a week or drop down to monthly. With TE, we recommend treatment for 1 year after stopping the loss, but sometimes we'll treat it longer just to maintain that healthy head of hair and prevent any future TEs, in the future. So in terms of supplements, we strongly recommend supplements since nutrition is so important in treatment and prevention of hair loss. A couple of options that we have here are Nutrafol. Nutrafol's great, super comprehensive. And then we have our line here, the Tresse RX, which is a 3-step series. The prebiotic is a powder that you use for 2 weeks to kind of prime your gut and GI tract. A lot of research recently has focused on gut health and inflammation and how that contributes to hair loss. And then the Tresse Revitalizer is great for a TE. It has a lot of B vitamins that will help kind of hang on to those hairs that you have. The fortifier is also important if androgenic alopecia or female pattern hair loss is also present and has a DHT blocking agent. So treatments we don't recommend for TE. When there's an active TE going on, we typically don't recommend doing an OPC or optimal platelet concentration or PRP injections, unless you also have androgenic alopecia or those miniaturized hairs with female pattern hair loss and that TE has stabilized. Minoxidil can increase shedding initially, and so once it's stopped, we recommend it, and it can, it can cause increased shedding once it stops. So we recommend it only in 3 situations. If there's an underlying androgenic alopecia with the expectation that continuing the minoxidil after the TE resolves. When someone has a chronic TE, when shedding doesn't improve after 9 to 12 months, and that shedding is so profound and rapid that there are actual evolving areas. So what can we do to prevent shedding? First and foremost, we want you to continue all the treatments you've been doing thus far for hair. Abruptly stopping either minoxidil, which was our prior 82M, or low-level laser therapy can cause shedding after a few months. This is a huge one. So eating well is super important in maintaining your hair. Focusing on things that are high in protein. Like I had mentioned, about 90% of your hair is made up of protein. So anything with yogurt, cheese, fish, lentils, smoothies, continue your supplements and vitamins alongside of a healthy diet. Stress reduction is key. It's good for your overall health and not just your hair. So looking into anything that can reduce stress. Everyone knows these: yoga, breathing, meditation, aromatherapy, chamomile, lavender, especially exercise is helpful. There's a lot of stress reduction apps like Calm and Headspace that have been very helpful for people. Getting enough sleep, making sure you have that balance of 7 to 8 hours of sleep per night. Helps with, decreasing shedding. There's a lot of relaxing teas, melatonin, supplements that aid in sleep. I had mentioned previously, and in previous webinars, we talk about the importance of gut health. So prebiotics and probiotics for your GI tract. As stress can kind of wreak havoc on your GI tract, and it affects the absorption of your nutrients. So making sure that your GI tract is healthy with pre or probiotics. And I mentioned the Tresse line has that prebiotic the prebiotic powder that you use for 2 weeks before starting, and then every other day thereafter. Other supplements we recommend that help is ashwagandha, so that helps with stress management. Ashwagandha comes in many forms, one being spirulina, which a lot of people actually put in smoothies to help, and then fish oil, turmeric, they help with inflammation and can help decrease shedding. So we have some time now for questions. So just if you have any questions, put them in the Q&A tab there, and I will try to answer them the order they come in. Like I said, if there's something I don't know or we don't have time to answer, we'll email you directly and get that to you. Okay, so there's a question here. I use the formula PM as 82M was discontinued. Does that still work? Yes. So really, we did a big webinar last week. We actually had the most participants ever with that one. People are super interested in minoxidil. The 82M was discontinued just because we had some issues with the pharmacy that was manufacturing it. And Formula PM we found is equally effective. And if you want to, you can go back to the webinar from last week that has a lot of detailed questions kind of distinguishing the two. Someone asked, is it possible, and then the same person just said I use the laser as well. That's great. So continue to use the laser. All these treatments, the biggest thing is consistency is key. So even if you're going through a period of shedding, continue to use your laser, super important, and it will benefit in the long run in regrowth. Someone asked, is it possible to have copies of these PowerPoints at all? So yeah, all the webinars that we do actually are posted on our website. So we post them, and everything is recorded, so you can re-listen to these. You can go through the slides and look through anything that was interesting to you. And again, if you have any more detailed questions, you can always email us or call us. So there's a question here. I use 82F, that's 10% minoxidil. Is it too strong for my scalp because I'm seeing dry, scaly areas? Possibly. So with the 10% minoxidil, it depends, you know, I'm not entirely sure the brand. And if 82F, you may also have finasteride in that. The strength in causing any dry, scaly areas can be from the alcohol content. So our formula PM has very minimal alcohol content, so it's really not irritating to the scalp at all. It has a retinoic acid, so it helps to kind of increase absorption. I'd really have to know like the specific one that you're using. Probably what I would recommend is trying a 5% minoxidil and see if that helps. You know, over-the-counter Rogaines have pretty high alcohol content, so something like in our office here, the formula PM is great for that. There's a question here. What do you think of taking biotin? If positive, what amounts? So biotin is great, but biotin alone actually isn't going to do much for your hair. So our supplements here, the Nutrafol or the Tresse line, all have biotin in them, but they work with other vitamins in these products that help to kind of work synergistically to improve hair health. So biotin alone actually isn't going to do much. You want to make sure your supplement has biotin along with other things in it, and Nutrafol and the Tresse line do. We'll leave a few more minutes for questions. Again, just type it into the Q&A tab if you have any questions. So someone asked, I have chronic TE and I've been using minoxidil for a year. Should I stop it? I'd recommend having an evaluation by a medical specialist, you know, one of us here or a dermatologist, excuse me, who can tell you whether or not yes or no. It's not great to abruptly stop minoxidil. You know, typically we'd want to wean it off. If there's certain reasons why you're coming off the minoxidil, you know, we never usually just stop it abruptly. We do use minoxidil in chronic TE too. So that is one of the exceptions for chronic TE using minoxidil. You know, the last webinar we did was super detailed on minoxidil. So if you wanted to kind of go through that, you could just to answer if you have any more specific questions. But minoxidil for chronic TE is a great option. You know, a lot of people can be afraid of it because minoxidil can cause initial shedding, which can be scaring for people already experiencing shedding, but it is a good treatment for someone with chronic TE. Again, too, you know, some of this stuff is so specific, seeing someone for an evaluation would be your best bet. There's a question here. Can you show these products so we can see them? I have some items, but I'm not sure the ones you have mentioned. Thanks. So the formula PM, we can, if you want to just shoot us your email, we can reach out to you directly, as I don't have anything here in the office to actually show the products. We're thinking of doing some video demonstrations coming up soon, so keep an eye out for that. You know, we're going to maybe do one with the minoxidil, with our 3X, the microneedling serum. So keep an eye for that. But if you want to just shoot us your email, we can get you that with the demonstrations of the products. So there's a question. I do the PRP every September. I use the formula PM and laser. Are they still good processes for me to do? Yes. So the more you do, the better. You know, any of these treatments for hair, you have to kind of look at it as a treatment for life. You know, we kind of like to compare it to, you know, if you have high blood pressure, you wouldn't just stop treating that high blood pressure. You'd want to continue treating it. You know, hair loss is progressive. So, you know, treating this for life over time, you know, depending on the situation, but the more you do, the longer you treat, the better results you're going to have. And yes, using the PRP, formula PM and laser, likely for what I'm assuming is like a female pattern hair loss, is the best treatment you can do. The only thing you're really missing is a supplement. Just leave a few more minutes. If anyone has a question, again, just type it into the Q&A tab. Okay, if no one has any more questions, we will conclude the webinar. We'll be here next week as well, same time, 12:30 next Wednesday, which is the 24th. Thank you.